The people of Dental Care 50 thank you for watching this video. On this tape, you will hear from some of the fine providers in the Kansas City area. But first, a message from the Director of Dental Care 50, Carrol Morris.
Hi, I'm Carrol Morris, and I'm the Director of Dental Care 50 of Kansas City. For the past 2 years, we've been marketing a dental plan in the Kansas City area called 5555 Dental Plan. What we are is a twofold company. First, we're a marketing service for the dentists and specialists on our plan, and second of all, we provide a dental service to those 50 and older, which has currently been an untapped market for a specific age group. What we've done is put together this video so that you can learn firsthand from some of our providing dentists and specialists on the plan how this actually works in their office.
Dr. Guy Gronninger.
Hello, my name is Guy Gronninger. If you'll allow me to take a few minutes of your time, I'd like to talk to you about the benefits of a new dental plan called the 5555 Dental Plan, or Dental Care 50 as it's going to be known as. It's an opportunity to increase your practice base, reach a segment of the population that presently isn't being served, the patients in the older portion of the market. The questions that a person might have as a practitioner would be things like, how is this going to benefit my practice? Any patient, and this is my own personal philosophy, any patient that comes through the door is an opportunity to expand our present patient base and our referral base. Even at a reduced fee, and the fees are competitive with other programs of this nature, will allow you to do dentistry. The kinds of things that have hurt my practice over the years are not reduced fees, but rather places in my schedule that are bare places, places that patients cancel, patients reschedule, just holes in the appointment book that I can't fill. And there's an opportunity here for real growth in a practice, reaching a segment of the population that currently isn't being served or is being inadequately served. I know there's a tremendous resistance for prepaid dentistry or insurance dentistry, and in the last 10 years we've seen a tremendous change. 10 years ago in the Kansas City area where I'm located, there wasn't such a thing as yellow page advertising, and of course we all know how that's changed. The resistance that we're seeing in terms of prepaid dentistry or capitated dentistry, I think is unusual, and is the kind of thing that's being vocalized by those practitioners that are not presently a part of capitated dentistry. It's sort of sour grapes. So I would encourage you as a practitioner, look long and hard at this program. If it fits your practice, then try it. Try it for a limited time basis. I mean, what have you got to lose? It doesn't cost anything to join. I thank you for your time, and I'd ask you to consider what 5555 or the Dental Care 50 can do for your practice.
Dr. Lynn Murray.
Hey, my name is Lynn Murray, and I practice in Kansas City, and I am a participating dentist in the 5555 plan. And there are several things that I've really been happy about. One, we seem to attract a very good type of patient. They're highly motivated. They're very intent on keeping their teeth, so we have been successful in establishing a good recall system. The patients show up for their appointments. They're serious about that. We've had good referrals from our patients. They refer other family members and grandchildren. Previously, our hours that were difficult to fill were morning hours, and these patients, many of whom are retired, have taken care of that problem because they prefer to come in the morning. Most of them get up and get going and like to get those things done with. And that they're very good about paying. We do bill, but we are giving them a reduced fee schedule, but we have found that many of them pay right when they come in, so we don't have to do any billing, and in any practice I think this is a plus.
Dr. Douglas Irvin.
Hi, I'm Doug Irvin. I've been practicing oral surgery in this office building for the past 30 years. I appreciate my patients and I try to deliver a good service to them. The past 3 years I participated in the 55-55 plan and found it very practical and workable. It is a simple plan and seems to satisfy the patients because they benefit from it, and also paying the fee at the time of services means that we get our money up front, so it's very gratifying to both parties that are concerned. I had a friend, a pathologist, asked me the other day if I recommended 55-55 because he wanted to participate in it, and I said without hesitation, yes, I do recommend it because it works, just because it is that easy. There's not that much involved. So I don't hesitate the least in recommending this plan to you. Thank you.
Dr. Gregory Peppes.
My name is Greg Peppes, and I'm a general dentist in Kansas City, and I've joined the Dental Care 50 plan about 2 years ago. I was a little leery about joining the plan, but after I gave it a little time, I found out that the quality of patients that this plan has is quite different than possibly a lot of different plans that you may see come into your office. It appears that these people have a lot more responsibility and respect for dentistry than what other people do. For example, showing up for their appointments, being on time, paying their bills. It's a type of patient that you really don't have to always hound to make their appointments or to make their payments. It appears as though they always pay for services when they're rendered. I've also had an increase in patient base, a considerable increase in patient base, not just by the people that are on the dental plan, but also by them telling their friends who have dental insurance, who may be younger, who have families, or their neighbors who also may have dental insurance of some other type, or cash-paying customers. In widening the patient base, it's just invaluable getting patients of this nature in, because it appears as though these people, when they come in and you provide them with a good service, will go home and they'll tell somebody. I also have had a considerable increase in procedures which possibly you may not do as many all the time. For example, there's a considerable amount of crown and bridge that's done because with these types of people, they've had fillings that have put in. When it's time to change the fillings, sometimes need a different type of restoration, an onlay or possibly full coverage. Dentures, considerable amount of dentures and partial dentures, which we all know in the prosthetic department of dentures and partials in crown and bridge, that those are a lot more financially benefit us than possible amalgams and cleanings of this nature. For anyone that's interested in possibly joining Dental Care 50, I would encourage them, I'd tell them to go ahead and give it a try, and it'd surely pay off.
Hi, I'm Sam from Dr. Peppes' office, and I love being involved in the 55-55 dental plan because from my point of view, there's very, very little paperwork. The patients are aware of the charges before they even come into the office. We have no hassle with them collecting fees. They pay cash. There's no billing. I'm not involved in trying to get in contact with insurance companies and hassling with them about any of the fees because the patient is aware of their fee before they come in. I have no problem making appointments. They're very good about scheduling their 6 months checkups in advance. They're just nice people to work with. And as far as the administration of the 55-55 plan, if I have any questions, all I do is call the office and they're willing to answer my questions.
Dr. Dan Muehebach.
I have a tendency to scrutinize pretty carefully any plan that I'm going to undertake. This one in particular, I didn't do anything for about a year. I quite honestly regret not having started sooner. It's a pretty legitimate plan in terms of benefits to the dentist and to the patient. It's not a capitation plan, which is important. I definitely steer away from capitation plans, but it does afford you the ability to be somewhat selective about your clientele. Obviously, it's all in one particular age group. The age group is very significant insofar as it's probably the fastest growing, or it definitely is the fastest growing age group in the United States, and it also controls the majority of the wealth. And I think the reason that it does control most of the wealth is because these people have been pretty conscientious about how they've spent it. They're very responsible individuals. They always show up. They're on time more often than not. They're early. They're exceedingly friendly and appreciative of what you do and how you treat them. I'm not going to say that 100% of them are ideal patients, because that's an impossibility. But a larger percentage in this population is more ideal than in the general population. I'm glad that I've joined the program. I have increased my production by about 15 to 20%, which is where I want to keep it. I don't want to exceed 20%. I think you start running into too many problems in terms of low profitability. But if you have any spare chair time at all, then this is a really good program.
Dr. Richard Knubley.
Wanted to talk a little bit today about the 55 Club and what my experiences have been with it. I think I started out originally, the thing I liked best about the 55 Club was, and I think the name has been changed now, and I'm not really sure what the new name is going to be, but was the ease with which you worked with people. You know, all of us in one form or another are working with third parties in this day and age, and the ease of this program was something that went along with my personality. No paperwork. You had a base of people that it turns out that it has been really a fantastic group of people to have in the practice. They pay cash as they go. They seem to have more expendable income than I thought they were going to have, quite frankly. And as I said before, the clients are the types that you really would desire in your practice. I've been extremely pleased with what has happened with this program, not only from the periodontal side of my practice, but also from the implant side of my practice. I've gotten many cases through this plan.
Thank you for watching this video. I'm sure that you found it to be most informative and interesting, and I hope you'll consider becoming a Dental Care 50 provider.